All right, so good morning and welcome to the Alzheimer's Disease and Related Dementias Task Force meeting. My name is Ursula. I am the chair of the task force and the director of the Ohio Department of Aging. As we have more people coming on, we'll certainly be sure to add them as well. You should have received access to both the agenda and the meeting minutes through the share file. I will, at this time, turn things over to Alex Lapso, our legislative liaison, to begin with the roll call. Alex?
Thank you, Director. Good morning, everyone. Just as we have in past minutes, I will begin reading the names of task force leadership, proceed through the list of governor's appointments in alphabetical order by last name, followed by the legislative appointments, and then finally the representatives from our executive agencies. I'll begin with Chair McElroy.
Present.
Vice Chair Francis.
Present.
Addison.
Present.
Beach. Blau.
Present.
Bolin.
Present.
Brockman.
Present.
Brode.
Present.
Berman.
Present.
Drost. Hockwalt.
Present.
Johnson.
Present.
Pakunka.
Here.
Mahajan is excused. Reese is excused. Russell. Schiffel is excused. Smith.
Present.
Stevick Rust.
Present.
Thompson.
Present.
Van Runkel.
Here.
I'll again call the name Beach. Drost.
Present.
Thank you. And Russell. Thank you. I'll now call our legislative appointments. Leader Yuko is excused. Senator Wilson is excused. Representative Creech.
Here.
Representative House. Representative House. And lastly, I will call the names from our executive agencies, beginning with Director Corcoran, Director Ashenhurst,
Here. I'm here.
Ombudsman Laubert.
Present.
I'll again call Director Corcoran's name. And lastly, Sini. Director McElroy, you have a quorum. At this time, I'm sorry, Director. At this time, I would like for us to turn to the meeting minutes. They were distributed last week. At this time, I would like to offer the opportunity to review and see if there are any additions, deletions, or substitutions to the previous meeting's minutes. Are there any deletions, additions, or substitutions at this time?
I move to accept minutes.
We have a motion from Ombudsman Laubert to accept the minutes. Do we have a second?
Catherine Bro, this is second.
And a second from Catherine Brode. Any objection? Hearing no objection, minutes stand as approved.
All right. Thank you, Alex. I just wanted to cover a few things in a brief update today. First, I wanted to thank the Alzheimer's Association and all those who made it possible for Memory Day on the 14th. I thought it was done really well and really great presentation and information. I'm not sure if there's anything you want to add to that, Trey. I know you're on the line.
Yes, thank you, Director. And yes, the program went well. We had close to 200 people attend, which was huge for a virtual event. The director obviously did a great job in addressing remarks, but one of the key components to this year that was different from last year was the research component that's really driving our public policy work across the whole. And a lot of that research was around early detection and prevention, which I know is a big issue that the task force will be tackling. But the research is truly driving some of the innovative things that we're thinking through from a policy and regulatory standpoint, which we were happy to highlight at the event. So thank you, Director, for your participation, as well as Governor DeWine, and we truly appreciate it, and we look forward to what's to come in the future.
All right. Thank you, Trey. Alex, did you want to give us an update on a couple of the bills, a couple of the House bills? And then we'll talk about the budget as it relates to the task force.
Well, thank you, Director. Yes, at this time, I wanted to take this opportunity to discuss House Bill 23. House Bill 23 definitely aligns with a lot of the work that this task force is achieving at this time. The bill requires that peace officers and EMS personnel receive dementia training. Some of you who are very locked into Cap Square may remember that there was a bill under the previous General Assembly on the same issue as House Bill 441. This bill, House Bill 23, has the same joint sponsors as House Bill 441. They are Representatives Plummer and Representatives West. And yes, so the bill would require that peace officers and EMS personnel receive dementia training. The Attorney General's Office, as well as the Board of Emergency Medical Fire Transportation Services, are required to adopt rules in order to consider the provisions within the bill. The bill would require that the rules that are to be adopted cover the following topics. They would have to identify, certain cues for individuals living with dementia, such as psychiatric or behavioral symptoms. Rules would review communication techniques on best ways to interact with individuals living with dementia, techniques for addressing those types of behavioral symptoms that I mentioned earlier. There was an amendment offered in the House in the Civil Justice Committee that would require that first responders be trained on identifying and reporting abuse, neglect, and exploitation of individuals living with dementia, and how best to provide that information to the County Department of Jobs and Family Services. Rules would also be adopted to address protocols on contacting caregivers. They would look at opportunities to look at local resources that are available within that jurisdiction for individuals living with dementia. In addition to those local resources, identifying organizations both at the local and national level that can assist first responders in locating missing or wandering individuals. As those rules are being adopted by both the Attorney General's Office as well as the Board of EMFTS, both the Ohio Department of Aging as well as the Department of Job and Family Services are asked to coordinate through the rules process to provide input on how best to establish those rules moving forward through the rules process. The bill was reported out of the House Commerce and Labor Committee unanimously on March 17th, and the bill passed the House almost unanimously with wide bipartisan support on April 15th.
All right, so Alex, if you want to give us just a brief update on the budget bill and as it relates to, or what would be of interest to this task force.
Yes, absolutely. I would like to start with the House during their deliberations of House Bill 110. They did increase the APS line item by 1.49 million per fiscal year. That is an increase from 4.23 million per fiscal year to 5.27 million per fiscal year. The APS line item is not specific to those living with dementia, but of course, those living with dementia could certainly, of course, benefit from any additional resources, whether monetary or otherwise. So we are certainly keeping an eye on that appropriation. Within the Department of Aging's budget, we do have our Alzheimer's and Dementia Respite Line, which continues to support individuals living with dementia as well as their caregivers. But what I would like to dedicate my time to today is actually on a brand new initiative that the Department of Aging is implementing through this budget. And it is a brand new appropriations line called the Statewide Aging Initiatives Line. This line is going to help us implement the Strategic Action Plan on Aging, which is a brand new plan. It was just published. It took over a year working with over 70 stakeholders to adopt this plan. The premise marries together our federally approved state plan on aging with our state's health improvement plan, with the goal of addressing gaps and deficiencies that we have been able to identify across the state utilizing our summary assessment of older Ohioans. This is a very comprehensive plan. At this time, Director, I know you can speak much more eloquently to this than I can, but obviously this is a very important provision. The House did remove this provision from the executive proposal, but we wanted to take this time to address the importance of this plan and how it relates to the work here as well.
So let me start. Thank you, Alex. Let me start with the dollars and cents. So what we requested was $23 million over the biennium. So that would equate to $14 million the first year, $9 million the second year. And as Alex mentioned, it is to, in part, to be able to implement our strategic action plan on aging. Now, I'll talk to you a little bit about this plan, but I want to first start off by tell you why this is important to you and to the work that we're doing here. There are 15 strategies laid out within that action plan, and there are many that apply here, but a couple that are particular to our work. The first is that there is an opportunity to improve home care workforce capacity and caregiver supports. So we want to improve support for those working caregivers, many of whom are caring for individuals with Alzheimer's or dementia. There's also a piece that focuses specifically on reducing cognitive difficulty. In other words, addressing cognitive health. How can we do that best? How can we do it early and more often? And the interesting thing about the Strategic Action Plan on Aging, it is built on the premise of early intervention, which is very much aligned with the work that we're trying to do here. It also deals with things such as improving social inclusion, which we know is also important and a part of and aligned with much of the work that will come out of this task force. And I'll just list all of them for you so you have an idea of just how robust the plan is. It addresses financial stability. It improves housing quality and affordability. Improving transportation access. Improving nutrition. Improving physical activity. Improving healthcare coverage and affordability. Increasing volunteerism. Addressing cardiovascular health. Reducing depression. So there's an emphasis on mental health. Improving chronic pain management and improving falls prevention. The goal of our strategic action plan on aging, that we want all Ohioans to live longer, healthier lives with dignity and autonomy. And we appreciate that there are opportunities to do this early and often, and at a lower cost, quite frankly. The way we design the 15 issues or the 15 strategies is that they are developed that there are many things that different people, both in the private and public sector, can get behind to support. I am bringing this to you here today because this is a really important effort that we certainly want you to be aware of and support of. Having the strategic action plan on aging, being able to actually execute the many parts of this plan will allow us to diversify the portfolio of how we provide services to older adults and those impacted by dementia throughout this state. We want to be able to provide those services earlier. We want to be able to provide those things that allow for those healthier outcomes. And what we know is that much of our health, 80% of it, is modifiable. We have opportunities to improve the outcomes. If you have not yet had a chance to see the Strategic Action Plan on Aging, I want to be certain, Alex, that it is placed within the share file. The document is very comprehensive. It is, I believe, about 85 pages. Now, listen, if you don't want to read 85 pages, I'm okay with that. So we've also provided a quick guide and an executive summary so you can get the highlights. But this is a really critical, pivotal time within our state and quite frankly across the nation, and how we provide and how we support older adults and those individuals impacted by many of the experiences that I've mentioned here: chronic pain, mental health, cognitive difficulty, and so on. This is an opportunity, particularly with what we've experienced during COVID-19, for us to be able to diversify how we offer services, when we offer services, and to whom we're able to provide those services. We have a lot of great opportunities right now, but there is absolutely more room or more ability for us to get in earlier and do more. Do we know if this will work? We absolutely know this will work. What you heard Alex state was that this plan was developed in part by aligning our work with the State Health Improvement Plan and the existing state plan on aging. Before we went any further, we actually conducted a summary assessment of older Ohioans. And what we saw were things that I don't think any of us are or should be comfortable with. We found in certain parts of the state that we had a 29-year gap in life expectancy just across different zip codes within Ohio. That is of grave concern, particularly when we know we have opportunities to be able to change the trajectory of that. And so throughout the summary assessment document, you will see many key findings. You will see where the disparities are, where the inequities lie, where we have opportunities to close the gap in many areas across the health spectrum. So I'm certainly open here to have a little bit more conversation about it this morning, but I thought it was really important for you to know that we are now at a place where we are hopeful that as we move to the Senate side, that we will be able to have the support to move forward this very critical line item for these very critical services. So again, in the share file, we will include the SAPA, the State Action Plan on Aging, the Strategic Action Plan on Aging, in multiple forms, the abridged version, the complete version. We'll also include the summary assessment of older Ohioans so that you can see for yourself, particularly in your own areas, how you perhaps are most impacted and which areas you could focus on, and how you can be supportive of what we believe is a really critical initiative that we want to roll throughout the state. And we feel really good in that I'm talking with and speaking with many of my peers across the country that we have already laid forward a blueprint while others are still trying to do so. So we are in a really good spot to do really great things, and we don't want to miss this opportunity. So again, take a look at that, see where you can be supportive of that, and all that information will be available to you. I don't know if there are any questions or comments on that before we move on to the next piece.
I actually have a question, not specifically on that, but on the Alzheimer and Dementia Respite Line. What does that actually cover, Director McElroy?
Right, so there's a part of it that is for support. So the idea is that part of it goes to the Alzheimer's Association and the different groups within the communities, and part of it goes to the area agencies on aging to help bolster the support. But it is largely for individuals or families who are in need of supportive services, perhaps once there's been a diagnosis, if there is, and that can range. There could be a variety of things how that could be utilized. In some cases, that is information. In some cases, it is a support group. In some cases, it can be a direct service. It just depends on what the needs are for that family or that individual and what that particular community has available to be supportive.
Thank you. So it could be a service, could actually give them respite in some way from
Correct.
Right. Thank you.
Correct. Absolutely. Absolutely. And again, it varies. And that, again, one of these examples, I would say, of why having the flexibility of early intervention and services to provide those early intervention strategies is we want to be able to provide service to individuals and not necessarily have it tied to a level of care or a particular income criteria. We want to be able to provide these critical services to people who are in need as early as possible, should they be in that circumstance. But that's what the Alzheimer's Respite Line allows you to do.
Thank you.
Mm-hmm. Oh, looks like
Director?
Diane, I think your hand is. Yes.
Yes, thank you. Director, is there anything in the strategic action plan, I may have missed this as you were going through line items, that specifically deals with diagnosis for Alzheimer's and related dementias? I'm just wondering because, of course, diagnosis is so key to then being able to ascertain
Absolutely.
resources.
So what it discusses is screening and care coordination, right? The ability to support that. There is a very specific call out under the population health section for cognitive health, and it states reducing cognitive difficulty. So it allows for a range of things, but it is very specific toward screening and care coordination, if that makes sense. There's a specific call out for that screening and care coordination.
Yes, thank you.
Mm-hmm. Okay. If there are no other questions or comments on that piece, I do want to move into now the next item, which is around the RFP. And I know there was some discussion around it last time. I do believe it was sent out to everyone. So I think we had agreed to make sure that it was forwarded to the group. So I'll just give you a brief update on where that is. As we had announced at the last meeting, we did work to issue that. The Ohio Department of Administrative Services, who's our lead procurement agency for the state, did issue that on behalf of the department on Friday, April 16th. The proposal period opened on Friday the 16th. It closes on Friday, May 7th at 1 p.m. There was a pre-proposal meeting held this past Friday, and that was to allow any interested vendors the opportunity to better understand the requirements and to ask any questions they possibly had. The title of the RFP, again, if you have to go back and reference some information we sent to you, is Consulting Services for the Alzheimer's Disease and Related Dementias Task Force. The term of the award will commence immediately upon effectuation of the contract, and it will continue through June 30th, 2023. The work will be approached in 2 phases. I think we mentioned this before, but I want to call this out again. Phase 1 is the immediate work of the task force to produce a report with the findings and the recommendations. The consultant will assist us in achieving this requirement. Phase 2 of the project will focus on implementing the selected recommendations in the report. Then we'll perform an array of tasks to make sure that they stick to and have the intended benefit. Now, we're not in a position to further discuss the content of the RFP until an award is made, but I can tell you that you are welcome to review the RFP. Again, it was sent out, but Alex, I know we forwarded, and if we don't have it in the share file, I would make sure that at a minimum, the link to DAS's page that houses the RFP is available for folks to look at. Again, from that link, you can view it, and you can view questions asked by potential bidders as well on that site. And they can submit their questions through Friday the 30th, the way it is set up. Catherine, looks like you have a question. I'll take the question before I continue.
Director, can you give a little bit of insight into how you anticipate this consulting firm to interact with the committees? Will they be coming alongside?
Right. My hope is, so for those of you who participated in maybe with some of the work with SAPA, et cetera, we want consultants who can sit in, listen, appreciate what the desires of the committees are, be able to help us move that into actionable recommendations and to formulate a really good report. There's also an expectation that to some extent, if there are other things that we need to research, they also can cross-reference across different committees. I mean, they're just going to be really good as far as the technical assistance and helping us to pull this together as a very strong and cohesive document. And so it's been my experience that having that support really frees up the members of the task force to really come forth with really good ideas, and at the same time have someone present who can capture those in a really meaningful way that we can later put into action. So they are going to engage with all of the different committees and to help us as one body create a very, I believe, powerful report. So I hope that helps a bit, Catherine. Mm-hmm.
Thank you.
Pete, I think I see your hand up.
Yes, thank you, Director. I was just curious if you had response to your offer of the pre-conference last Friday, and maybe how many, if there were responses, how many folks attended that?
Right. You know what? I'm not sure how many were there. I know it was hosted. I don't have the exact number. I didn't sit in. I had my assistant director sit in, so I didn't check back with her to see how many were present. I do understand there were.
You did have some interest.
Is my understanding correct?
Okay.
Mm-hmm.
Thanks.
I would say, yeah, and again, any updates on it, we'll make sure that the link to the DAS site where any of the questions from any potential bidders, anything that is publicized, make sure that you have access to that link to kind of keep track on it. You can share the link, with vendors that feel they may be good candidates for the opportunity, but you should not, I do want to stress, engage in any conversations with those who might be interested in applying. So because it's a competitive opportunity, every potential bidder must receive fair and equal treatment. So just simply inform them of the opportunity. That's fine to do, to pass the opportunity alone. If you do receive a question, inform them, again, as a task force member, you're unable to answer any questions pertaining to the RFP, even if those questions are related to the work of the task force. So instruct them to submit the question on the RFP page in the inquiry section. And that's why I said I want to make sure you have a link to that so you can see that's where they should post and ask their questions in between DAS, the Department of Administrative Services in our department, will work to quickly review and post those responses to any questions they might have. So what you can expect next is after May 7th, when the proposal period ends, the evaluation period begins. We have already identified our evaluation team members who will review and score the proposals received based on pre-established criteria. Clarification will be attained where needed, and then there will be a finalist chosen. Once the final discussions occur, the contract is executed, and then the consultant will begin working with the task force and the committees. So again, this is really important work. We want to be certain that we have the support necessary to help us move through this work, and that is the process as it stands today. Just wanted to provide you with an update that, again, we've pushed it out. Link is out there. If anyone's interested, you can forward the link. Don't engage in the conversation. Have them post their questions, and then we'll be sure that a response is provided. So, oh, Pete, looks like your hand is up. I think I see your hand up. Yes.
Yes, I did raise it again. I'll ask a question that I'm sure is on a lot of people's minds. Do you have, and we won't hold you to this, but do you have a anticipated ETA for the consultant to work with the committees?
All I can say, I don't have an exact date. I can tell you, as you can see, we're trying to move. Yeah, as you can see, we're trying to move here. So once that period closes, we're going to get started right away on the evaluation and hopefully a selection. Because the sooner we can get someone in, I think the easier and the better it will be for them, as well as the group, for them to sort of mix with us and understand where we're trying to go and help guide us in how we want to structure things. So I would say as soon as we're able to. So that doesn't give you an exact date, but again, remember it closes on the 7th, and then we're going to start evaluating shortly thereafter. So.
Thank you.
Absolutely. There are no other questions or comments on that piece. I am going to turn it over to Alex. I think at this point he's going to talk with you about the committees. Have a little bit of discussion. I understand all the committees have had a chance, I believe, to meet, and we're interested in how that has gone. And Alex, I'm going to turn it over to you.
Thank you, Director. Yes, at this time, we'd like to hear from the committees and provide ample time to hear updates, discussions on deliberation, what's currently being addressed, if there's an opportunity to address what the committee has already achieved, next steps moving forward for the committee based on previous discussions. But also, I think this is a great opportunity for the full task force to interact a little bit as well. If there's an opportunity for one committee to collaborate with another, I think this is an opportunity to begin those conversations. We thought it would be appropriate to allot approximately 20 minutes per committee to offer those updates, those report outs, as well as any opportunity for Q&A, discussion, deliberation, etc. And so at this point, I'd like to start with the capacity committee.
Okay, this is Sally Bolin, and I will start off the discussion and welcome and appreciate any additional comments from my co-committee members. Our committee has met twice. We will meet again tomorrow morning. And from a process standpoint, we decided after our first meeting that we actually had two other individuals who had offered to help support this committee. And so Representative House and Leanne Smith are both co-chairing the committee so that we can share the workload with this committee. On the shared drive, we do have, there's a subcommittee file, and certainly individuals are welcome to take a look at that. We have some documents floating with our minutes and our agenda, and our committee has homework that we're doing in between our meetings, so there's opportunities for committee members to upload materials. So just so that everyone's aware, there is information on the shared drive from the capacity committee. In our first two meetings that we had, we did spend some time reviewing our charge, kind of defining what that meant. I think that we're still working through that as we have worked through each element of the committee charge. I think, we all have some comfort level in regards to the different topics, but also realize that there's room, there's a lot of room for additional information. We've spent some time talking about what we may know that exists at the state level. So an example of that could be what type of regulations are currently available for dementia training requirements in assisted living and nursing homes. Some of our committee members have some firsthand experience with that and are able to, through their expertise, share that. Representative House has also shared some great information about and is pulling together some resources from the Council of State Governments. And so what we spent some time discussing and working on trying to pull together before the consultant comes on board what resources we can bring to the table. Because I think we all felt pretty strongly that we didn't want to duplicate what was already out there. Why identify or complete an assessment if it's already existing either at the state or national level. We're starting to work through, we're about halfway through. I think by tomorrow we should be a little bit more than halfway through each of that elements on the chart that we reviewed at our last meeting. And I think that we've had some great discussion, and various committee members have been able to share their expertise because we have a lot of individuals who come from a variety of areas, and we're continuing to gather information, which we will share and upload on the shared drive. Excuse me. I don't know if any of my committee members have anything else to add, and I'd be happy to take any questions or refer them on to some of our committee members. So. I don't know if that was too high level, if you want me to dig into details. I think we're still a committee in progress.
Are you finding that within your committee, do you have both the expertise, the experience that you need, or is it something that you feel you will need to branch out and to bring or consult with others?
I think the answer is yes on both levels, Director. I think that, there's some, all of our committee members bring some great expertise, which they're able to share. I think we've had a lot of questions. One of the things, and please correct me if I'm wrong, committee, but I think a couple things that have been forefront in our mind is what's already there existing at the state level. I know we're trying to lean on, Alex and to pull together some of that, and then what's already existing within our systems that we can bring so that we're not duplicating. So certainly I think that there's probably a lot of information from other committee members, like, probably, the AAAs can share a ton of information that's already out there. It is just one example that is certainly not represented in our committee. So I think the answer is yes to both. I think there's some great experience on the committee, but it's certainly not completely comprehensive. And I think what's exciting is there's so many wonderful resources out there, at the national level, at the state level, at the regional and local level, that we'll be able to tap into and I think learn from, so that we're not reinventing the wheel. And my hope is because of that, we'll be able to take it the next step forward, so.
Can I add something, Sally?
Yeah, that'd be great. Thanks, Jean.
Sure. This is Jean Thompson. I think one thing that we thought we should have, which Sally mentioned, is we need to find out where we actually are right now. So, even the name of our subcommittee, capacity, says, what do we have? And so we know where we're starting before we're moving forward. But I think that the subcommittee determined that while that we might need help ultimately from the consultant in actually in some of these capacity areas to have real numbers and what is there and what's not. So I think that we have not, we certainly are going to utilize the consultants to dig out. It's not as easy sometimes as you think might find all of these capacity numbers. So I think we are going to utilize the consultants for that kind of thing, in addition to the expertise of committee members.
Okay. And I think I remember this had come up before, particularly with maybe this group. Are there things on here, and I'm not sure how it's been operating yet, Sally, and your entire committee, but are there specific things that maybe through the share file or way that it's in, that if we have the ability to research or get, we can start trying to get some of those things for you if you don't have them. So that would be helpful, because you do have a pretty good list here of things, and I want to make sure I understand exactly which numbers you would benefit from having in your committee. So I don't know if that's something you'd want to do, share those very specific things through the share file, and that way we'll know what we need to get back to you.
I think that's a great idea, and we can certainly have some. I'll add that. We can add that to our agenda for tomorrow to start creating that list. Because I know we did have a discussion last week in regards to what numbers are available through the state, what numbers are actually real numbers, what numbers are statistical numbers that are just applied in some sense because we don't know. And then we also, which Representative House brought up, which I thought was a really great point last week, it's also just talked about, particularly when we were talking about diagnosis and symptoms, is that, even in some communities that people are not apt to get a diagnosis. So how do we even know? And so how do you put those numbers in? There's just a lot that, I think that's a great point. And we can talk about that tomorrow and start to come up with a list. Because I'm not sure if we all know what's actually available through the state.
And I think part of it too, as part of the capacity committee, it would be my expectation that, if part of the challenge is we don't have the system or the way or the means to capture some of these things, I think that's an issue too, right? So we know what we know, but these may be the limitations on what we know and how we're able to capture. So I think that's something that needs to be noted as well. Are there places where we know that we don't have the information at the level that we believe we need to have it? So this is a very, as all of the committees are very important, but being able to know where we have those gaps and also where we perhaps are doing well or have the information is going to be very important in trying to figure out where we need to plug holes or where we can build upon. So really excited about this group. Is there anything that stood out to you that would be good for the rest of the group to know? Like any ahas or anything just generally that you're finding right away in your efforts together?
I think one of the things that stood out to me, and certainly, I know we had a lot of discussion about it, and so, I would defer back to my committee members too, is, I think that, looking at, what are some things that some states are already doing, and what we can learn from them, I think is good. We had an interesting discussion last week about the word surveillance system, and the wording of that and what that means, and and just the words in general, and how words can be meaningful, and so that was kind of an interesting discussion that stood out, and just being really careful about what kind of words we use, is important. So I don't know if the committee members have any other thoughts or anything they'd share.
And I would say too, I'm curious on this, and then we'll move on to the next committee. I would also say that with the capacity committee, as you're doing your work, and I'm sure this will apply again across all committees, to also be, I guess, cognizant of or make clear how it ties to some of the other larger issues that we know hit, I think, a lot of our systems. So, for example, I think we've heard workforce, right? And I think that can mean a variety of things, what that means, et cetera. So I would absolutely anticipate that there would be something very specific from this group, but very much related to general themes that we know persist right now, right? So just want to make sure that we're being thoughtful that way as well. All right, I don't know if Sally, if anyone else from your group has anything. If not, Alex, I think you move us on to the next one.
Thanks for doing a good job, Sally. We appreciate it.
Oh, thank you. We got a good committee. It's a group effort. So.
All right, Alex.
Thank you so much, Sally. Our next committee is the Science Committee.
Who's science? Who's up?
Sorry, my microphone was muted. This is Lori Stevickrust, and I'm co-chairing with Trey and Greg, and so I'll just kind of launch and start and then have the rest fill in the blanks. So our committee also has met twice, and we also made sure that we had homework assignments in between. We're meeting every Monday to do that work. The way that we approached the overarching goal, which we know is to take the science and bring that to the bedside, bring that to the communities, to really provide an integration of where science is driving best practices. And so our strategy was to take those diamond areas that were identified in our committee, that were assigned to the science committee, and then to break those down into themes, because we know that the literature and the data is huge, and we wanted to make it something workable. So we broke that down into 3 primary themes, knowing that we would ultimately then take the core amount of work and integrate that back into the strategic action plan that's been proposed. So with that, we broke down into groups of 2, and then our groups, or our dyads, then worked on each of these categories. And we approached it looking at what is the overarching goal, and then how we know if we're moving the needle, what the measurable outcome will be. And within that, looking at identifying, I think much like you talked about in the capacity group, Sally, is where are the gaps? What do we have access to? How do we dovetail into what the Alzheimer's Association and the literature that Trey can bring in terms of program and program development? And so that's really, we're in a work in progress right now of being able to continue to come back and out and consolidate even further the data that we've been able to gather and the strategies we've been working on in our pairs. Trey or Greg, do you want to add anything to that process?
Yeah, Lori, I would just say, this is Trey, and I think, well summed up. And the one thing that we would probably do as we start to boil down to Lori's point is really look at the key researchers that the association can bring to kind of speak to each issue. That way, again, to Lori's point, we're starting to kind of think about programmatic solutions and things that we can actually execute on through the lens of where the research and science is going, so that we're not behind, but we're at the forefront of where things are trending. So, to Lori's point, it's definitely a work in progress. I think as we look at areas of early detection, prevention, even something as simple as billing codes as it relates to physicians, all of those things are top of mind, just knowing that, we can get ahead of this thing through the lens of the science committee. So that's all I would add, Lori.
Thanks, Trey.
Yep.
And the only other concern we have is overlap of efforts. This is Greg Sini. We're concerned that we're going to overlap our own efforts as well as efforts of other committees. I don't know if there's a way to measure that to see where everybody's putting effort towards, to see if we could leverage the work that each other's committee is doing and then be able to take that and move it forward. But yeah, and also understanding, this research consultant and how and when they're going to be able to support us will make a big impact.
Absolutely.
Absolutely. So with your the folks you're looking to bring in, Trey, you mentioned some of the researchers, et cetera. Are those at a cost, or are those individuals that this is a part of their work and we can access them and maybe even have them present to the full group at different times? Is that something we can look at?
Yes, absolutely. And I think, definitely full group, no cost. Obviously, the association we don't bear cost. They're all staff. And so pretty much we can probably discuss kind of where or what areas, Director, you and the team would like to brief on, more particularly to the committee's work, really looking at, some of the areas of the diamonds, of course, that we need to focus on, and how we can kind of boil down that research. One thing we do have the ability to do is literally dredge up and present based off of where various topics may be. So that could be a new drug in the pipeline for treatment. We can go specific on that and how that impacts the work, as well as things like Project Echo, health systems work, et cetera. So we've got the research and so we can literally brief on most topics that we have issues and crossover on with each committee.
Okay, thank you. That would be quite helpful. And I think that is, as we finish or wrap up the conversations here with the different committees, I think something we ought to talk about in how we want to structure kind of moving forward. So, because I think that would be helpful for the group to have someone come in, talk with us about a very specific topic, so that we're constantly building our knowledge as we're building this here plan or these recommendations. I also am being very thoughtful about, does it make sense? Is it possible to even look to some of the other states that perhaps have done something similar to see what their experiences have been and how well they've been able to implement some of the things they've put forward? So this is really important work, and we really want to see things happen. Yes, sorry.
I'd also be interested in hearing from researchers from maybe some universities that we have here in Ohio that have some grants to do research on brain health and so on.
This is Sally Bowen. Yeah, one of the other areas we talked to, just piggyback on what Bev said, is, what's available maybe through Scripps or some of the other universities too in Ohio that are doing some research. So I know we had some discussion about that at our committee level too.
Yes, and I'll echo Greg's comment as well. Our challenge and our charge, and the reason that we're trying to make sure that within our group we are consolidating that data, making sure that we're not overlapping, and that what we're trying to do to bring to the bedside is the most important, because we know that there's a lot of great research, but it's vast and it's hard to mine that data and then to actually put that into actionable interventions, both for the medical teams and the caregivers. And so we know that that is our overarching goal, and yet really wanting to be very deliberate about how we group that data together. So that's where we're at.
Absolutely. Okay. Bev?
So yeah, Lori, you mentioned bedside. I think there's a lot going on about prevention. For example, there's a researcher at Ohio State that has a lab that looks at physical activity and brain health. And so I think we need to look more broadly and, again, see what resources are available right here in Ohio.
Absolutely. Absolutely.
All right. So I think Alex just moved us on to the last committee.
Yes, Director, that would be the Experience Committee.
All right, and I'm going to be presenting for our chair who is traveling today. And as others have noted, please, committee members, chime in if I've missed something in the overview of our work of the past month. So I just want to cover 3 different areas that we've been working on or the process that we've been working through. Our first step was to lay out a process map for ourselves, as you've heard in the other committees describe, how we're going to do the work that's ahead. And we concluded that we needed to have some resources that would help us provide a foundation of information for us to begin to lay out our work. And so thanks to the Department of Aging team for helping to schedule 3 of our speakers. So our last meeting included a presentation by Dr. Robert Applebaum and by Eric Van Vlymen and then by Rick Hoover. And those 3 presentations were loaded with information. I think we could have had a 2 to 3 hour meeting with each one of them with the kind of information that we were getting. And let me just give a snapshot of some of the key elements of each of those presentations. So Dr. Applebaum really laid the foundation for the work that Scripps has been doing. And that work has been related to their longitudinal study, which has been going on. And frankly, I forget the year that began. But that longitudinal study is just an amazing source of data. I'm sure everybody on this call has seen what we used to call the heat maps. But an interesting phenomena is emerging in the projections now. And that is that actually, if you look at the state of Ohio's growth in the next 20 to 30 years, it's relatively flat, the demographic growth across all age groups. So think about that, back to that workforce comment. And so you've got a flat population growth. But if you look at the 80 plus age group, that has tremendous growth. In 2030, it's going to be 36%, and for the 85 and up age group by 2040, 34% growth. So that needs to be understood alongside a very flat population growth in terms of workforce availability. And he also spoke to prevalence, dementia prevalence, and noted approximately a 35% prevalence rate for those 85 and up. And think back now to that stat that he just provided for us and the growth in the demographic, and then apply the prevalence rate to that growth, and you see the challenges ahead in the next 20 to 30 years. He also highlighted the disparity of that prevalence related to racial disparity, and that's very concerning in terms of how different areas and minority populations are affected. So that information is very informing for our work. He also provided some statistics from the longitudinal work that speak to the percentage of those severely disabled in the state and how and where they're cared for. So the question of capacity is in a very important way understood through the percentage of individuals who are cared for in the home, reflecting, of course, the caregiver needs that we have. And in fact, he noted that for those who are with a physical and cognitive severe disability, less than 22% of those who are over the age of 60 live in a nursing home right now. We had a brief discussion about the prison population, and I know this is not new to the thinking of some, and the importance of understanding the needs of those who are in prisons who are impaired with dementia and need to have care and informed care in those settings as well. But 43% are at home being cared for by the family, and less than 5% are paying privately for that. Lots of unpaid caregivers who are involved in the care of those with dementia. And Dr. Applebaum closed by noting some policy implications for us and encouraged us with one particular concern, which is not the first time that we've heard him talk about this, but it is something that I think it's important for our committees to understand, and that is that there are perhaps some competing policies at the local level where you have levy funds that are trying to maintain their levy funding levels, and so taking opportunity to encourage people to move on to passport, and therefore, could there be a way by which the state policy and those local policies align so that we're really leveraging the best dollars out of both? So with that, we then turn to a presentation by Eric Van Vlymen, who is the Region 10 Director of the Alzheimer's Association. That's Ohio, Michigan, and West Virginia. And he gave us great information. He provided the numbers that are estimated to be currently served or currently with Alzheimer's or related dementias in Ohio, and that's 220,000 with an estimated 600 and plus functioning as caregivers. An important thing that I think it's that all should understand when we hear the Alzheimer's Association's mission and vision, and I believe Trey has mentioned this before, but when you hear the Alzheimer's Association work, they have expanded their mission and vision to incorporate all other dementias. And so he provided an overview for us of the research work that they're doing, their focus on risk reduction, early detection, and care and support. And I don't want to replicate what we've heard in the other committees' work or what Trey has already told us. But I think one of the most important things that Mr. Van Vlymen ended with in his report to us was he felt that Ohio was really well positioned for this plan, and it harkens back to what Trey just mentioned on our call, which is that with the timing of Ohio's work may put us actually at the very front edge and leading edge of understanding how to create a plan that works with current emerging research so that we are positioned in a way that really sets us on the right foot to take maximum advantage of the work that's underway right now. And he also noted the work that that they are doing in Ohio with a CMP submission. And that CMP submission, they're doing some more work from other research of other states where they're doing this, but they're really trying to develop a dementia care practice recommendations that can be used within facilities. Really important because that's a lead into our final presenter, Rick Hoover, provided for our committee an overview of the state and federal requirements in terms of dementia training within the facilities, the RCFs and nursing homes. And what we learned in that presentation was details about how many hours are required, the specific language of those requirements, but most importantly, that there is no specific standard of training content or way by which to measure some of the language that's within the federal policies in particular. So we ended our meeting with a encouragement by our chair, who had put together a task list for us, went through all of the different areas, the topics that we are to be looking at in the experience committee, and we have laid out a task list and a more specific process map that we'll be looking to in our next meeting. So what have I missed? Turning to my other committee members that you can chime in and help fill out my report.
I just thought I'd define for people who aren't familiar what CMP is. It's a civil money penalties. It's a fund that the Department of Medicaid manages of fines that that nursing homes pay for non-compliance. So that money is available. You have to get it approved by the Department of Medicaid and Centers for Medicare and Medicaid Services, and it has to be used for quality improvement in nursing homes. So just wanted to explain that acronym if people aren't familiar with it.
And that last comment that Bev made is really important. It is very focused on nursing homes, not RCFs. So that research needs to be done there.
This is Jennifer. I think the other thing that we talked about just at the very end of our last meeting was the need to hear directly from people in all aspects of the system what their experience is. So it tags along with our experience committee. But, you know, to hear from a couple of caregivers, to hear from a couple of workers or aides within a memory unit, to hear from physicians. And I bring that up here only to say that that's something that we're considering and may be of interest to the other committees.
Thanks, Jennifer. You know, one additional piece to that I failed to mention is that we're also looking to build an online way by which we can collect even more. We're calling them narratives. So trying to bring as many voices as possible, given in the limited amount of time and the ability to have all of those in person, hoping that online access will even broaden and expand the number of narratives that we can obtain. Any questions for us?
It's a very interesting and good report. Thank you. I appreciate it. Thank you. Thank you. So what this does for me is it brings a few things up, and I want to talk about this as a large group, and then Alex, I'll turn it over to you for announcements, et cetera, and sort of next steps. So it is clear to me that for us to be successful or as impactful as we want to be, we're going to have to be really engaged with education throughout. And that is both with us bringing people in to help educate us, but also I think that we should be very proactive at the time in educating others. So it's one thing for my experience has shown for a report to land and you have to, one, explain the recommendations, but also all of the context and history about why it's important. I think we will be well served if we are very intentional about our messaging and our educating people about this work throughout, if we bring them along and not just once we get the report, right? So that becomes really important because I do think many people may not understand the prevalence of dementia. Many people may not understand how there are inequities or disparities across different groups with both access and treatment, et cetera, outcomes, et cetera. I don't think people necessarily realize or have contemplated, if you're not operating in the space all of the time, some of the very important policy implications and long-term impacts it could have, not just on those who are directly involved, but also those who are indirectly involved. And so I think what's going to be really important for the group is for us to be thoughtful about what messaging do we want to carry throughout and during this work, so that when there is the release of our recommendations, there will, one, have been anticipation, but two, already education, so that there will be the appreciation for it. So I think that's going to be really important if we're going to be successful. So that's one on the education front. Two, in listening to this conversation, and I believe we talked about it before, but we had not yet really set up a structure or a means to do it. While we do live stream these meetings for the public, and while we do place the recordings of these meetings up following in the meeting minutes, et cetera, once approved, I think it is also going to be important for us not to push out information, but for us to get information. We've talked about this before, so I'm really happy to hear that the one committee was addressing that and looking at how we can do that. So how are we able to hear the stories and narratives and the really important feedback of individuals who are living with this or who have experienced this? I think we're going to have to be really intentional about that. I do like the idea about an online way for online narratives. And I think we're going to have to think, are there ways to actually have people share information with us in some sort of live fashion? I'm not sure yet how we can do that, but I do think it's something that I'm open to hearing people's thoughts on how we can make that happen, because that is really important and it's going to help inform a lot of our work. And then third, I think we should also be thinking as we continue to move through this work, how will we be able to fund some of these efforts. I think we're going to have to be really thoughtful and intentional in looking and considering ways to do some of these things. I mean, some of these things are going to require resources. So as we begin to step out a plan and recommendations, I think we also, in tandem with that, should be considering how can we truly move these forward and what resources are going to be necessary to do these things. So for example, if you come up with a recommendation, it would also be helpful along with that recommendation there to be some consideration or thought, or how would we actually be able to, or what would be required for us to be able to move it forward, just to be thinking in that direction. So, because that's going to help us generate a realistic plan and then also an aspirational plan as we make our way toward. And I think we also can do this in a phased way as well. So those are my thoughts just in listening to the committee's report out here. Are there any other thoughts or comments that we want to think about and consider as we continue to really start to dig into this work?
Director, I very much like your idea about educating people as we go. I think that that is really helpful so people really understand what we're about. And I think it might be really good to have in the report, as well as this ongoing education, to really address our language and how we use language in talking about people who live with dementia, as well as their caregivers, and just make sure that we're modeling for the public and educating the public and caregivers about dementia. You know, this weekend I read a blog written by a man who lives with dementia, and it just really debunked so many myths about people who live with dementia. And the more we do to identify dementia with early diagnosis, the more we're going to see people who are living with dementia that the general public and, you know, people who know them may not understand that they are still functioning and what kind of adaptations they need and so on. So I think the more we can do to educate people about that, the better.
Thank you, Bev. Thank
I'd
you.
also really encourage individuals on this task force as well as broader to listen to the presentation that we had. It was just really powerful and packed with information. And one of the examples that was given to us by Eric Van Vlijmen was that there was some research done at a health system in the northern part of the state, and less than 1% of those over 65 were screened for dementia in their health system. So, you know, the information that's available to us as a task force would, through that presentation, is just really powerful to be part of the education. And I too really affirm that idea of making sure that we're bringing individuals along in an understanding of how to communicate, how to express the challenges in a way that is, you know, appropriate and sensitive.
Absolutely. Leanne?
Yeah, thank you. I just wanted to add in, I love the ideas that all the other committees have spoken about, and I love the idea of the online possibility of some narratives and some experiences and things. I guess I would just mention about maybe confidentiality from the people that may want to submit that. Privacy issues. They may be having concerns with a certain facility or a certain, you know, maybe an experience that they don't want to throw somebody under the bus, if you will. I don't know if that makes sense, but I feel like if there was going to be an online presence or forum, you may get more people to share experience without maybe identifying them publicly, if that.
I gotcha. That's a very good point. Thank you. And we will take back and think of that, because we've had other groups and that had sensitive issues, and finding a way to be sure that we could treat that or handle that in a way that didn't lend itself to your point, placing them in an uncomfortable situation, but still allow them to contribute. So thank you. I will make sure we take that back.
Thank
Right,
you.
folks. Chief Cleo. That's a really good point you raised. Thank you.
Thank you.
Any other comments or questions from the committee reports? Okay, seeing none. I noticed as we were moving along, some of my colleagues weren't here, so I wanted to make sure that I did acknowledge them if you didn't. And I didn't know if they had anything they wanted to add in particular. I see Director Corcoran's on, Director Ashenhurst is on, and our Vice Chair is on, Dr. Mary Kate Francis from the Department of Health. So I don't know if there are any comments or anything in particular that you want to share before we move on to our final piece of the agenda. Not to put you on the spot, but I want to at least make sure that I acknowledge and give you an opportunity.
Director, this is Maureen Corcoran. I just add to the comments others have made about it's fantastic to hear the depth of conversation about the research and about what the implications are for some of our strategic and policy thinking going forward. So I appreciate everybody's work on this.
Thank you. Thank you. And I think Director Ashenhurst was on. I know I saw her on. I don't know if I missed her before she had to pop off or not. And Dr. Francis, I don't know if there's anything you wanted to add on behalf of health. I wanted to make sure I gave you an opportunity.
I just appreciate everyone's input and work so far. I think what was brought out in the news recently regarding our beloved Jack Hanna will bring even more attention to this and more attention to our efforts. So I think, moving forward, that will assist us in the attentions and the work that we're getting done. I don't think I have anything else to add. Thank you.
Okay. Absolutely. Thank you. So with that, Alex, I know you had on here some general announcements. Is there anything you wanted to touch on there before we adjourn?
Yes, absolutely, Director. Thank you. I just have two quick points. One is with regard to use of the share file. I'm happy to hear that many of you in the committees are utilizing the share file to the collective benefit of this group, not just the committee's work, but also to everyone on this task force. That is going to continue to be critical. Please feel free to continue to add as much information in there as possible. Today, during the opportunity for the committees to report on their work, there was obviously that opportunity for interaction. The share file can certainly fulfill that purpose outside of the opportunities for us to meet collectively as a group. So please feel free to meander about the share file to review what other committees are doing that can provide for additional robust discussion. The next point and the last point is committees moving forward. We would certainly like to extend the opportunity for committees to meet in addition to our regularly scheduled times here at the end of every month. The committees have had opportunities to meet, and that's fantastic. We're certainly happy that all of the work is being achieved and that we're moving forward with these discussions. But since we have dedicated time at the end of every month for these regularly scheduled meetings, we wanted the opportunity for the committees to meet at this time as well. So moving forward, our hope is that as the agenda is provided, there will be links for the committees to break out at the conclusion of this meeting to continue their efforts independent of any regularly scheduled meetings that the committees may have independent of this meeting. So please be on the lookout for that moving forward. Thank you all. Really appreciate it.
All right. So Alex, if you want to go ahead and properly close out our meeting.
Oh, Director, before we do, I believe Leanne Smith has her hand raised.
I think it was still up. Am I wrong, Leanne? I just thought you still left it up from last week.
Yes, I apologize. I will lower my hand.
Oh,
thanks,
looks
Alex.
like Sally's hand. Sally, what's your hand is up?
I do wonder too, if we have extra time, if there might be two committees that might want to meet during this time, unless I'm not understanding what you're saying, Alex. That might be helpful too. I think some of the things that our committee talked about mirrored some of the things that Catherine talked about with Dr. Applebaum, and so and I know Jean had talked to I think Jane Straker too. So it'd be great if maybe there's some opportunity to do that as well. Just a suggestion. If committees don't want to do that, that's okay. But I that way we might be able to share, and because there's definitely some overlap in some areas.
Sally, if I may, if I could ask for some additional clarification, are you asking that that during this regular meeting right now that there would be the opportunity for those committees to meet, or would that be we would adjourn and then offer the opportunity right after this meeting for those committees to meet?
I think either or. I guess some of it might depend on time for people too. I mean, either I think would be okay. I was just thinking, I know that it seemed like listening to what Catherine said, it paralleled some of the discussion that we had too. And we may have gotten nuggets from each other, that could have been informative to both of our work. So, but from a process standpoint, I'm not sure if I have a strong opinion either way, Alex.
No, we appreciate that. My one comment would be, and I'm no direct expert on public records law, but my one comment would be whether or not in anticipating this that there would be enough opportunity for public notice of a committee, realizing that our committees, just as this task force, are subject to open meetings and public records laws. I believe the time frame is 24 hours. Perhaps, though, there is an opportunity where both committees could potentially work together and schedule a joint committee meeting. That is certainly something that I would be happy to help fulfill here very quickly moving forward, given the unique and overlapping interests of those committees.
I thought I had raised my hand. Perhaps I haven't. Jean Thompson.
You have.
I wanted to ask, it was my understanding listening to Catherine that I thought we could access on the share file the reports of Dr. Applebaum and Eric and ultimately Rick Hoover. So to me, I'd like to take that opportunity. I'm also trying to communicate with our chair, Sally Boland. I thought if we can, maybe what's best for the capacity committee, and you're right, we think those reports are really important, the longitudinal study. Perhaps we could first listen ourselves to the presentations that were made for the experience committee before discussing it.
Sounds like a good plan.
Well, I mean, I just don't, I thought that Catherine said those were on the share file, but I'm not certain about that.
Can you confirm, Catherine? Are they on there?
They're not in the share file. There is a link that Alex can provide or Tessie can provide that have all the recordings of our meetings. So that is actually, I had to leave our last committee meeting early, and so I was able to go back and see and listen to the remainder of the meeting by viewing that. And all of the committee meetings are recorded, and I believe in that same link. Alex, would you confirm that?
I don't see Alex on. If it isn't, we'll make sure it is. How about that? We need to make sure that the link is for the other committee meetings. So, okay.
Yes, I'd be Director, to your point, and Catherine, to your point as well. Yes, our ultimate goal is to have all of that published, both publicly on our website. We can certainly look at opportunities to provide that through the share file as well.
All right. So it looks like we're at about 11:24. Jean, do you have another comment? Go ahead. I want to cut you off.
No, sorry.
That's okay. All right. All right. Are there any other questions or comments? If not, I understand you need a motion to adjourn because I think we've covered everything here today. You'll have 35 minutes back.
I so move. Jean Thompson.
Jennifer, I think you're saying second, but you're on mute. I think.
Yep, I'm seconding, yes.
All right. All right, so assuming there are no objections to that, we will go ahead. That will conclude today's Alzheimer's disease and related dementias task force meeting. Again, keep checking that share file. As I mentioned before, as we get into this, you're going to see more and more information pushed in there. And that's how we can communicate in between time. So thank you all for your time. Hope you enjoy the rest of the week and look forward to seeing you again.
Thank you.
Thank you, Director.
Thank you.
Absolutely.
Thank you.
Thanks. Bye.